Welcome everyone. In this video, I wanted to talk a little bit about uterine artery embolization, but most importantly, we need to talk about why do we do a uterine artery embolization. So the first thing to know is that you shouldn't have a hysterectomy without first consulting with an interventional radiologist. Specifically, if you're pursuing a hysterectomy for management of fibroids. Fibroids are a specific type of growth that happens in the uterus, and it doesn't belong there. And when you have multiple fibroids, they can be small or they can be a little bit bigger. But the most important thing is that they can cause symptoms. And sometimes the symptoms might or might not relate very well to the size. In the past, hysterectomy was the only option to manage patients with a lot of fibroids. Sometimes the fibroid could be removed surgically as well. But either or, both of those procedures would be pretty invasive, or at least more invasive than a uterine artery embolization, which we can do through a small incision in the groin or even through the radial access. So we can access a small artery from the wrist, and we can deliver the treatment, which are small particles that occlude those vessels, in order to achieve a reduction in size of the uterine fibroids. So really, I really want to make this as a overall recommendation to check your options before you pursue more invasive procedures, and you can consult with an interventional radiologist to see if you qualify or not for a minimally invasive treatment. I want to show you, this is an image of a schematic of a uterus, and you have all the different locations in which you can have uterine fibroids, and depending on those locations, your interventional radiologist is going to determine whether you qualify or not for this type of treatment. So I'll add more information in the links below. Don't forget to subscribe and share, and please feel free to comment with any questions, okay? Until next time.